Alright, so one more thing I want to do in this position. A little bit outside of what we were just doing as far as different patterns go. But just a great exercise and a great resistance that you can do in hook lying. For a lot of patients, whether it's lower extremity patients, hip patients, back patients, one of the things that they really struggle with is rotation, okay? Especially trunk rotation. Especially a low back patient that's had an injury or had a surgery, they are terrified of doing any rotation because they can't do it very well. And a lot of times they have certain segments that are completely inhibited, so they can't even control rotation in certain segments. So this is a good position to work on some of that. So the low trunk rotation that we do in hook lying, so start in the same position, so feet and knees are together, okay? First I'm just going to passively bring you, okay? So what I'm going to do, and I'll do this like I do it with a patient just so you can see what I'm doing. First my hand's just going to be on your ASIS and just blocking it, okay? So now if I bring your legs down towards me like we're going into rotation, but I don't let you move here, let's just see. So that's about as far as we get. And that's about average is where most people will go. You can only get about so much hip rotation before the pelvis starts going. Okay? Then if I let the pelvis release and let this come up, so you just relax, just let me move here. Now I let his pelvis release, his pelvis will start to rotate towards me. Then I can put my hand right underneath and palpate his lower lumbar spine starts to come off the table, his mid, his upper lumbar, until we get all the way down to really his mid-thoracic that starts to come off the table. Okay, if I have him keep his shoulders down, I'm not going to go so that his whole thoracic spine comes off the table. Okay? To come back from here, this is really what we want to train, is that sequential rotation. So the way that I'll explain it to you first is feel if I slip my hand underneath here, and I'm on his spinous processes, okay? So if I get all the way up in here, feel how right about here is where you start to come off of the table, okay? So without me doing any resistance yet, what we're going to do, just so you get an idea of this, is I want you to try to think about pushing this level down in towards the table. Perfect. And then we're going to work our way down level by level. Now we're going to push this one down, and we're going to do segmental rotation so that he can get his body, bring his legs back up. Okay? So the way that we do this with resistance, there's a PNF approach to it, is I'm going to do it with traction. I was talking with a few of the groups before that once you add traction, you get much more core engagement, much more trunk facilitation. So if I bring you down here and let your legs come down, and I hook on to the distal aspects of your thighs, and I just start to traction away from you, it's going to feel like a lot of resistance. You do not need to give a lot of resistance with this at all. The traction is really enough resistance. Okay, so just like I was talking about, feel how your upper back is off of the table right now. Now I want you to start to pull that back down into the table. Okay? And now we're just going to work your way down. Think about going level by level. So flattening your lower thoracic, your upper lumbar. Keep going. Keep going. So that mid lumbar starts to come down. And we're going all the way until you start to rotate and get your pelvis back on, and then the legs come up. Okay? What I don't want it to be, and I'll see a lot of people doing resisted trunk rotation, and they do this and just resist the legs pulling back up. Okay? We're not trying to train just legs pulling back up. I want to get that segmental rotation. There's a lot of other treatment techniques that we do if a segment, they can't control it at one segment, where we'll go in and do resistance at those segments. But for now, I just want you to get the idea of that traction to get the rotation. Okay, so I'm going to bring you down here, and I'm just pulling slightly away from me, or slightly towards me away from him, and I want you to just flatten that back out, and bring your legs back up. And you can see what happens to his trunk as I add some rotation to it. We're just going to go to midline. Good, and then let me slowly bring you back. So knees come, then your pelvis comes, then think all 5, 4, 3, and we're just segmentally rotating off of the table. Okay, now here's where I start to resist. So go ahead and start to pull that back up. So it's that his trunk is pulling his legs back up because I'm rotating, because I'm tractioning here rather. Okay, let it come down, we'll go one more time. I don't resist on the way down. On the way back up, I'm here giving very light resistance with my traction, and pull back up. Keep pulling, keep pulling, keep pulling, keep pulling. Good, and let it relax. Okay, so why does that make it PNF? Well, we're doing some manual resistance. I'm doing it with traction. I'm doing it in multiple planes, so it's a way that you can start to develop some rotational stability. if you think about the orthopedic world, a lot of athletes, this is one of the best exercises you can do with them, especially if they've had a history of back pain. Anyone that does any type of a rotational sport, your baseball players, pitchers, tennis players, golfers, a lot of times they can't swing because they don't have rotational stability at each segment. So just to be able to do some resisted trunk rotation is a great exercise for them. Okay, so I know it's a little bit separate from what we were doing before, but let you guys try this for just a couple minutes and we'll move on to a different